primary complaint that patients come in with typically in shoulder problems is pain. Oftentimes pain at night is the final straw that breaks the camel's back that brings the patient in.
Having aches and pains, especially during the night, these are symptoms that Dr. Stephen Pearce will discuss in this next segment to help avoid potential joint damage.
The most common problem I deal with is issues associated with the rotator cuff. Rotator cuff tears, or a process called impingement syndrome. And on this shoulder model here, of course, is the shoulder. Now, the rotator cuff are muscles that attach around the shoulder joint. So we have a model here that shows the rotator cuff muscles that are underneath the big deltoid muscle, which is the muscle that provides the profile of the shoulder. And one of the most common problems is a rotator cuff tear. And that usually comes to surgery. There's some rehab involved with that. Oftentimes that can be dealt with arthroscopically. Another common problem we deal with is arthritis of the shoulder. Not as common as hip or knee arthritis, but can be very debilitating, painful. A lot of patients will come in with difficulty sleeping, limited use of the arm. In that instance, we do a shoulder replacement, somewhat similar to hip replacement. So we replace the ball of the shoulder joint, typically with a metal ball with a stem that goes down in the shaft of the humerus. And then on the glenoid side or the socket side, there's a polyethylene disc. So instead of having bone, rubbing on bone, which is painful, we have a metal and plastic joint. And they generally do very well. A lot of shoulder surgery can be done arthroscopically, which is nice. Smaller incisions, more cosmetic, less pain. By and large, most of the time it's outpatient, so it interferes less with work, etc. So that's a big advantage for a lot of procedures. A lot of rotator cuff surgery can be done arthroscopically. But obviously you get into more involved procedures like a joint replacement, then that's typically going to be done as an open. And most patients after a joint replacement will stay in the hospital about 2 days. The thing about shoulder surgery is a lot of it is rehab. It's a lot of rehab involved afterwards, not necessarily going to a therapist's office, but doing home-based therapy, following the doctor's orders and restrictions to get the best result. The primary complaint that patients come in with typically in shoulder problems is pain. Oftentimes pain at night is the final straw that breaks the camel's back that brings the patient in, being unable to sleep, and that could be on the basis of rotator cuff pathology, osteoarthritis of the shoulder. And one of the things that patients need to be aware of is, to stay out of my office, is we have a very fit public that works out a lot, lifts weights. I've seen a lot of patients that come in primarily just because they're not proceeding with how they want to work out properly. And so I would advise somebody that particularly it's not knowledgeable about lifting weights or getting into shape is to maybe have a trainer work with them for maybe a couple weeks before they really launch into it. Start off with light weights with higher reps. Avoid flies, avoid military press, and that might keep you out of my office.